All righty, good afternoon. We're back in the House. Thank you very much, or the Senate, I guess in this case. Thank you very much for all of you for being here. We're going to start out with a BDR introduction, and so Mr. Thorley will take over in just about 2 seconds.
Thank you, Madam Chair. Wayne Thorley for the record, LCB Fiscal Analysis Division. There is one BDR which requires committee introduction. This is BDR 57-1236. This is the budget implementation bill, eliminates the account for the regulation and supervision of captive insurers in the Fund for Insurance Administration and Enforcement. Again, this is to implement a budget decision of the money committees. Happy to answer any questions.
Any questions, committee? I'll accept a motion.
I'd so move to introduce the bill as read by Mr. Thorley.
Senator Nguyen, second by Senator Titus. Any discussion? All those in favor say aye. Aye. All those opposed say nay. Motion carries. Thank you very much. All right, we are going to go slightly out of order because we have a City of Las Vegas sitting right here ready to rock and roll. And so Senate Bill 54, if you will come up, we will get you started. All right, go ahead when you're ready. Thank you.
Thank you, Chair, members of the committee. For the record, Randy Robison, Director of Government Affairs for the City of Las Vegas. Thank you for hearing this bill, Senate Bill 54. This relates to the Recuperative Care Center that the City of Las Vegas operates. Many of you have at one point or another visited that facility and seen the good work that we're doing there. Essentially, the Recuperative Care Center provides a place for homeless folks to recuperate and recover after discharge from a hospital. If you and I go to the hospital for some sort of emergency medical condition, when we get discharged, we go home. For a homeless individual, they go back to the streets, which makes it hard for them to recover, which generally means they go back through the cycle of the emergency room and that sort of thing. So we've been operating this care center for several years now. What this bill would do is authorize, we've been working with DHHS and Healthcare Financing and Policy. This would authorize them to pursue a waiver from the federal government to provide medical respite care, which is a term specific to the homeless population, and have some of those services covered by Medicaid. The reason that we're here is originally there was a fiscal note on the bill. We amended it in the policy committee to bounce that effective date out to the second year of this coming biennium. Once the Economic Forum came through with their news, we decided to bounce out that effective date yet again to July 1st of 27. So there would be no fiscal implication in this biennium. This would simply authorize the division to go ahead and pursue that waiver. They've reliably told us it would take a couple of years, probably at minimum under normal circumstances, to achieve that waiver. And of course, nothing is quite normal these days. So with this bill, we've been assured that the amendment that you hopefully have seen by now, changing that effective date yet again to July 1 of 27, completely removes the fiscal note, but still authorizes them to pursue the waiver. With that, I'd be happy to answer any questions.
Thank you very much. We do have the amendment, and Senator Nguyen has a question.
Thank you. I was able to be one of those people that went out and toured the facility, so I appreciate you guys taking the time, and I like the kind of innovative work that you have been accomplishing out there to give people an opportunity to recover in somewhere that is safe than where they might otherwise be recovering and then running into that cycle. So in this case, the reason you were bumping out that fiscal note was not necessarily just to push this out to the next legislative session, but it's your understanding that under normal circumstances, applying for this waiver through usually take some time and potentially could take some additional time. Is that correct?
Thank you, Chair, Senator Wynn, Randy Robinson, Las Vegas. That's what we've been led to believe, or I shouldn't say it that way. That's what we've been reliably told by Division of Healthcare Financing Policy. Thank you.
Thank you. And I see Administrator Weeks shaking her head in agreement back there, not on that. I'm assuming she's the reliable one.
That's always a good thing, yes.
Thank you, Chair.
Thank you very much. Senator Neal.
Thank you, Madam Chair. So I understand what you're seeking, but what I'm trying to understand is when you guys received, the City of Las Vegas received the ARPA dollars in order to build this out, it was roughly 8.2 million that you guys used. How come you guys didn't plan for the respite care that you were actually going to be engaging in and make sure that you were going to have enough revenue from the actual city to pay for it?
Thank you, Madam Chair, Senator Neal, Randy Robinson, City of Las Vegas. So we did, you're right, we did receive some ARPA dollars to expand the facility that we currently have there. That facility was a retrofit of an existing commercial building. And when we expand, it will be almost double the size, double the capacity. We in terms of the operational cost of it, right now we don't have, we're not able to receive Medicaid reimbursement for many of the services that we provide, like other facilities that provide similar services or other providers can do right now. So it was part of the plan to pursue the Medicaid code. In fact, we tried last session, and there was some discussion in the homeless bill that was, the Campus for Hope bill that was passed last session to do exactly this. We had worked with DHS at that point. So this effort has been in the works for since just prior to last session, at least. This bill makes things a little more clear, a little more precise in terms of the services that are included and potentially covered, and of course who is eligible for those and how it would actually work in terms of seeking reimbursement. So it isn't, I wouldn't characterize it as we didn't plan for this as much as we have been planning since we opened that facility.
Follow up? Yes. So the $7 million expansion that you guys are doing now, so you're expanding, but yet I guess the first that I have was if you were doing $7 million to expand, but you didn't have the city general fund in order to pay for the existing population, then why are you seeking to expand without being able to just take care of the actual population that you have before the expansion and the expansion of, expense of $7 million, right? Because that $7 million technically could be used for the care model that you guys invested in with the ARPA dollars.
Madam Chair, Senator Neal, Randy Robinson, City of Las Vegas. Technically, that $7 million is capital money, so it couldn't necessarily just be used for operation. We'd have to make a change there. That $7 million was part of the match of the state ARPA that we received to expand. And part of the reason that we decided to expand is because this service is partially filling a gap in the continuum of care. Again, previous to this facility, I would say the vast majority of homeless folks who experienced some kind of a medical issue that drove them to the emergency room in the first place when they were discharged, literally were just discharged back to the streets. We learned through, during the COVID pandemic, when we operated the ISOQ facility in conjunction with the county, that homeless folks needed that space, just like you and I need that space, to recover, to be safe, all those sorts of things. Additionally, when they're at our facility, An average stay is about 60 days. While they're there, there's intensive case management to get them connected to other services so that when they are discharged, they are hopefully most often in a much better position in terms of either transitional housing supports, employment opportunities, those sorts of things. So it's not just about helping them recover from the medical issue, but we try to put them on a better path than when they came to us. So the expansion really came as a result of we're at capacity 24/7, 365. So the need is so much greater than we're able to provide. This facility is the only type of its kind, only level of its kind in Southern Nevada. And so we're providing a bit more of a regional service than just a city jurisdiction service. So that's part of what drove that expansion. And at the time that we received the state ARPA dollars, there was tremendous interest from the state in helping to expand that facility so that we could accommodate more folks. While we're glad that we have the capacity to expand this facility, and it will almost double the capacity that we have, it will still not be nearly enough. But this particular effort, if we were able to get the waiver from the feds, would help to offset some of that operational cost the city is completely absorbing at this point.
Madam Chair, one final question. So in the fiscal note, it's saying that basically 26 million would be paid for with the federal Title X funds, even though this is something you're trying to push off or to hit the biennium later. But the total effect on future biennia was roughly 52 million. So what's the other half? Where's the other half? Is that supposed to come from the state? Is the federal money? Because, you know, we're sitting here saying, well, it'll hit in the future biennia, but what amount will hit in the future biennia?
Thank you, Chair, and to Senator Neal. I might phone a friend with Ms. Weeks.
Yeah, because
This might be out of my
I
depth.
want to know.
I was getting ready to call your friend for you, but I didn't quite get there. Thank you, Ms. Weeks. Sorry to interrupt you, Senator Neal. Go ahead.
Chair, Committee Member Stacy Weeks for the record, Nevada Medicaid. So the reprint, the bill, so reprint one, the fiscal note and the effect on the future biennium is actually roughly 8.5 million. And so future years, yes, that would increase over time. Originally, the original fiscal note assumed way more facilities would offer these services. But as we know, there's really one that's really able to at this time. We don't see very many of these popping up over time. They are actually pretty costly because we do not pay for room and board.
So that's helpful. So the county that testified on the other side saying that they did some form, they wouldn't be included. And I guess that answer that first part. I guess this is how I feel about this bill. That I get it. You want help with homeless services, and that's important. But the first thing that I thought was, okay, you want the state to step in and help for a facility that you built with ARPA funds without a future plan. And then at the same time, run around and then not really support other measures related to the state. And so I felt like you might be a little selfish asking for something from the state and then on the other end trying to clamp down on what, because I was like, well, how do we benefit? Like, what do you guys give to us? Like, how do you support the state? And my answer was, this session, you don't. But so I understand that I'm just not going to support this bill, but I can just leave it right there.
Senator Taylor, did you have a question?
Yes, I did. Thank you very much. Thank you, Chair. I appreciate it. Thank you so much. My question is, and this is just probably just because I'm new to the Finance Committee. So if we approve this, and I know you've put off implementation until the next biennium, but if we approve this, does it become a part of the base budget going in?
Chair, Committee Member Stacy Weeks for the record. The goal here is to get the waiver over the biennium, which will take at least 2 years. If we have sufficient funds, which we sometimes have a surplus, like this last fiscal year before the biennium, we could come back to IFC and say, hey, we have a surplus, we want to actually go ahead and implement this. If we do not, then I would hope that we could build it into the base. That's something we were going to hopefully work out with LCB fiscal. Because if not, then it would be a problem for us to fund it going forward. Or we can build it into our budget through the governor's budget.
Okay, thank you so much. Thank you, Chair. That answered my question.
Any additional questions? Senator Titus.
Thank you, Madam Chair. So, to be clear, we heard the policy, and I certainly understand that from, again, the fiscal conservative component of healthcare, by having wraparound services and places for patients to go, in this case, homeless. If we don't have a place for them to go once we see them in our ERs and we just take care of the wounds or whatever, then they're going to come back to the ER. And it's been pretty well documented that increases the cost of care. So nationwide, the theory in healthcare is to make sure that you have these wraparound services, because it will save, not only is it better for patients, excuse me, but it's better for the system and the cost and the ER burdens. My question, so the policy I like, again, from the fiscal aspect, I like the policy. My question is that Medicaid waiver. Has that Medicaid waiver been approved in other states?
Chair, Committee Member Stacy Weeks for the record. Yes, our understanding is at least 4 other states have approved waivers. There are 5 pending, and I want to say a couple other states are in the process like we are, trying to find our way forward.
And follow up if I might, Madam Chair, if we get this waiver, then from the federal government, then we will be reimbursed for this care.
Chair, Committee Member Stacy Weeks for the record. Yes, that is correct. We'll be getting a federal match. Many of these individuals are 90% federally funded too. So that's a lot of our homeless population are adults without kids, who are the expansion adults, which we pay $1, the feds pay $9.
Well, and that's my next question, if I might. That federal component of the adult without children, in this certain population that you have identified, there's a lot of talk about removing those folks, but the folks that are in this category would probably not be some of those childless adults that are removed.
Chair, Committee Member Stacy Weeks for the record. Are you referring to removed as in federally?
Medicaid qualifications, correct.
At the federal level?
Correct.
Madam Chair, Stacy Weeks for the record. Well, just to be clear, the federal bill right now does not do anything to our 90% match.
Correct.
So we are good there right now as today. Again, it's fluid, as like I said earlier, but that we should be receiving 90% match for many people in this population.
Right, and that's what I wanted to get on the record, as how this process works for this particular group of folks. And again, I think it's fiscally sound because it is a huge burden on the healthcare system and the cost of healthcare by not taking care of their medical needs. My issue was the policy was it was too limited to just Las Vegas, and hoping that if this works, it will be expanded.
All righty. Any other questions from the committee? All right. Any words of wisdom? Anything to add? All right. Then you're off the hook if you'd like to step back. And we will go to support here in Carson City. If you will come forward. I wasn't lying when I said it'd start in a bit, didn't I? Go ahead, please.
Thank you, Chair and Committee. My name is Sabrina Schnur, Sabrina Schnur, and I'm here today on behalf of the Nevada Primary Care Association, which is the state's federally qualified health centers. We are proud of our FQHC members for doing this work, and we are very happy to support this bill. Thank you.
Thank you very much. Any additional support here in Carson City, in Las Vegas, and online, AVH, when you're ready?
Chair, your public line is open and working, but you have no callers at this time.
Okay, thank you. Opposition here in Carson City.
Good afternoon, Madam Chair, Dondero Loop, and committee. My name is Joshua Skaggs, and I'm the Legislative Affairs Director for the Nevada Republican Party here in opposition to SB 54. Despite the implementation delay that eliminates the fiscal note in the current biennium, there is still over $8 million in future biennia in estimated expense. That is actually the more important number anyway, because that is intended to be a long-term program. The bill states that these benefits will be provided, quote, to the extent that federal financial participation is available, end quote. We're concerned that this is poorly defined. Is there a requirement that the federal government cover all costs, or, for example, would be covering 50% of the costs meet the requirement, leaving Nevada to cover millions of dollars in additional Medicaid costs for non-core Medicaid services? I'd hope that we learned a lesson about putting Nevada on the hook for additional Medicaid expenses based on promises of federal aid with our ill-advised Medicaid expansion, which initially moved Nevadans with incomes between 100% and 138% of federal poverty level off the federally financed Affordable Care Act to state-funded Medicaid. Now the federal government wants to end their temporary support of the expansion and will need to move these people back to the ACA where they were to begin with. Nevadans deserve stable and secure support programs, not ones dependent on the whims of federal financing out the gate. Due to potential for significant expense to the state of Nevada for services not related to the core Medicaid mission, we ask that you please vote no on SB 54. Thank you.
Thank you very much. Any more opposition here in Carson City? Las Vegas? And phone lines AVH when you're ready.
Thank you, Chair. The public line is open and working, but you have no callers at this time.
Thank you very much. We'll go to neutral here in Carson City, Las Vegas, and on the phone lines AVH when you're ready.
Chair, you currently have no callers at this time.
Thank you very much. Any closing comments? Okay, then with that, I will close the hearing on Senate Bill 54, and I will open the hearing on Senate Bill 35. And thank you so much, Ms. Benitez Thompson, for joining us and jumping right over here. We apologize for all the long wait, but you are here now, so thank you. Please go ahead when you're ready.
Thank you so much, Chair Dondero Loop, members of the Senate Finance Committee. My apologies, I was in my office, and the minute I looked away from the screen, you guys started. So I want to apologize publicly to Michael Morton from our office because I ran out of the door and abandoned him and left him behind to catch up. It's that time of session. So SB 35, I'll give you just a quick 2-paragraph overview of what the bill is and then go straight to the fiscal note. So the section 1 was removed by amendment. What we have left, we are in chapter 212, which is related to prisoners. So we're changing the term intoxicating liquor in NRS 212-160 to defining intoxicant as a controlled substance analog, spirituous or malt liquor or beverage, synthetic cannabinoid, or any other chemical poison or organic solvent. And then in section 3, what this bill is looking at is increasing the penalties for sexual abuse of a prisoner under 212.188 from category D to a category B felony, and increasing the penalty for unauthorized custodial contact from a gross misdemeanor to a category C felony. So to the fiscal note, the original version of the fiscal note from NDOC was $333,000 in each of the fiscal years. As of 9:23 a.m., you should have received the updated NDOC fiscal note that was sent to me. And so that reduces it by a third. It's not completely gone, but it's listed at $133,000, just over $133,000 a year. With the removal of Section 1, they anticipate, as opposed to 10 offenders in their first original fiscal note, 4 offenders, the impact to NDOC. And we don't necessarily take quarrel with that.
Thank you so much. We're all just getting ourselves under control after having no internet, and so we just got our new staff. Thank you very much.
No, it's like you're flying blind.
Yeah, it was a little bit interesting. Okay, thank you very much. Any questions on this particular bill, SB 35? Senator Taylor, do I see you, maybe? Oh, I see. In other words, you're talking in class. All right, Senator Neal.
Thank you, Madam Chair. So was this rolled into the AG's budget, or this will be outside of the closing?
Thank you for the question through Chair Dondero Loop to Senator Neal, Teresa Benitez Thompson, with the Office of Attorney General. So this is not part of anything associated with cost with our office. This is the fiscal notes originating from NDOC. And if you look at their fiscal note, they've got the average daily offender cost at $91.43. So these are their calculations with anticipated for offenders that could result from this bill.
Okay, thanks.
So Senator Wynn.
So we've seen a lot of these, like, what I call purely speculative, like, fiscal notes where someone from NDOC is just estimating how many people they think will break the law. Is that what this number is based on?
So through Chair Dondero Loop to Senator Wynn, like I said, I'm not going to take exception with it. I'm not, if another state agency says that they need the resources, I believe they likely do. I'm not here to give NDOC a hard time. We do see an increase in the amount of intoxicants that are being brought into the prison and harmful results because of that. I would say that hypothetically, down the road, you could see a trade-off in maybe fewer crimes being committed by prisoners if they're not intoxicated, or less money on that side, but there's no way to really figure out that math. But so we don't necessarily take issue with what's being presented.
All right, any additional questions or comments? All right, thank you very much. If you'll step back, we will go to those in support of Senate Bill 35 here in Carson City, in Las Vegas, and online AVH when you're ready.
Chair, your public line is open and working, but you have no callers at this time.
All right, we'll go to opposition here in Carson City, Las Vegas, and on the phone lines, AVH when you're ready.
Chair, your public line is open and working. You have no callers.
Thank you very much. We'll go to neutral here in Carson City, Las Vegas, AVH when you're on the line.
You currently have no callers at this time.
Thank you very much. Any closing comments? All right, then we will close the hearing on Senate Bill 35, and we will go to Senate Bill 60. Is there anybody here to present Senate Bill 60? All right, we will jump to 62 and wait for Mr. Ashton to come back. Thank you very much. Welcome back, Ms. Benitez Thompson. Happy to have you. And go ahead when you're ready.
Thank you so much. For the record, Teresa Benitez Thompson with the Office of Attorney General, working from SB 62, first reprint. So this bill thematically is addressing support to victims of different crimes in different ways. So you do see within Section 5, 3 different types of dollars being asked for 3 different types of programs. 2 of them from our office. The last one I'll have advocates speak to. So first and foremost, within Section 5.1 to 5.2, you've got compensation to victims of crime. This is the pot of money that is run by Department of Health and Human Services. And what we are specifically asking for is $30,000 in each state's fiscal year to specifically go to victims of hate crime who have had property damage, to allow up to $1,000 remediation for each instance. And so where we got this from was when our office attended a Peace Officer and Faith Forum. We heard a lot about the property damage that happens from hate crimes, and that the fact that people have to go out of pocket for it, and that would be helpful if there could be some type of compensation for that, and it's something not currently covered under the current Victims of Crime Compensation Fund and the types of fees that are paid for harms done to those particular types of victims. And the next pot of money, this is specific to our office. This is section 5.3 to 5.4. So last session, in order to help our office come in compliance with Marcy's Law, you guys were so kind as to give us 2 victim witness advocates. These victim witness advocates are specific to the prosecution side of the House and the prosecutorial work that the Office of Attorney General does. So we hired them, we brought them on board, they did policies, they are killing it. They're doing a great job. But one of the things that we realized is we really need just a small pot of money for them to help on that victim witness side in order to keep compliance and come into compliance with Marcy Law, and to provide supports to those victims in the same way that like your city attorney victim witness advocates and other system advocates do, like with the DA's office and such like that. So this is specific to the types of crimes that we do. Lastly, is we were asked if we could help out with a conversation to support victims of human trafficking, and we had a germane bill. We said we would be happy to do so. AG Ford jumped at the opportunity to be able to do so. And so that is section 5.5. I believe that there's been an amendment submitted from the advocates to reduce that down to $200,000 a year from $1 million. And so I believe that's the final ask before you right now.
Thank you very much. Questions on this? Senator Neal.
Thank you, Madam Chair. So how many incidents or estimates of the property damage because of a hate crime are you expecting to exist?
Thank you for the question. We appreciate that. So our Teresa Benitez Thompson, Office of Attorney General, through Senator Dondera Loop to Senator Neal, we don't quite know. Our office received a grant from the Department of Justice to engage in more hate crime work, and we've set up a hate crime hotline. We have an average of 4 to 6 calls coming in a week. These are folks who are looking for supports and resources, and we do see a number of people asking about resources related to property crime. We know that nationwide we see hate crime stats. They fluctuate, but they've been on an overall trend in recent years. There's a discrepancy between what we see in hate incidents and then the actual hate crime enhancement that gets used. So if you go to Nevada crime stats, you can see the number of crimes charged as hate crimes where that enhancement was added, and those are around 80 a year. But it doesn't get down into I would have to look again, but I can't recall if we've got specific data on if it's a property crime or not.
Thank you. Any additional, Senator Titus?
Thank you, Madam Chair. And again, thank you for being here. Just a question regarding the comment you just made that the office received a grant from the Department of Justice. Was that just to look at numbers, or could that grant be used for this instead of our general funds?
Thank you so much for the question to Senator Titus through Chair Dondera Loop. Was not dollars. It's staff. So it's specifically staff, and it's one staff person to stand up and operate the hotline, and then an assistant position, 2 assistant positions to take calls and respond to calls. And then they've been trauma-informed trained. And so that's a helpful piece for it. And what we'd like to be able to do is be able to direct them to the resources. We direct them to like Department of Health and Human Services for those victim crimes and what they can pay for. What those pay for, though, when you look at it, is a lot of like funeral expenses, medical expenses, a lot more in line with like a heavy physical assault type of remediation.
Thank you. Thank you for the clarity. Thank you, Madam Chair.
Thank you very much. All right, any other questions or comments? Okay, thank you very much. You may step back. And we will go to those in support of Senate Bill 62.
Marco Rauda, for the record, representing the Nevada Policy Council on Human Trafficking. I want to thank the AG's office for putting the expenditure for the $200,000 into the account. We had requested $1 million, but we know that times are tough, so we're hoping to just get the 200,000. This will go a long way. You guys were generous enough to give the fund some money last session, and that has helped so many victims. There's a report out. I think you guys already received it, but we would like to continue to help victims with this little extra. So once again, thanks to the AG's office and thanks to this committee for hearing this bill.
Thank you very much. All right, any additional support here in Carson City, Las Vegas, and we'll go to the phone lines, AVH, when you're ready.
Chair, your public line is open and working. You have no callers at this time.
Thank you very much. We'll go to opposition here in Carson City, Las Vegas, on the phone lines when you're ready.
You currently have no callers at this time.
Thank you very much. And we will go to neutral here in Carson City, Las Vegas, and on the phone lines, AVH, when you're ready.
Your public line is open and working. You have no callers at this time.
Thank you very much. Closing remarks? Okay. All righty. With that, I will close Senate Bill 62 hearing. Thank you very much for being with us today. And we will open the hearing on Senate Bill 60.
Thank you, Chair Dondero Loop and committee members. My name is Patrick Ashton, and I'm a committee policy analyst from the Research Division Legislative Counsel Bureau. I'm also your committee policy analyst for the Senate Committee on Commerce and Labor, but today I'm here in my capacity as coordinator of the Nevada Silverhead Legislative Forum. I want to emphasize I'm nonpartisan staff, so any bills before you today, including this one that I will present on behalf of the Forum President, Fran Almaraz, I can neither support nor oppose any measures before you. So the Forum President, Fran Almaraz, is unable to present Senate Bill 60, which revises provisions governing crimes committed against older or vulnerable adults, and per her request, I'm here today. And before I continue, I want to point out 3 exhibits that should be available for you either on Nellis or on your desk. One is an informational memorandum prepared by staff about the forum. The other one is a letter that the forum president sent to Chair Dondero Loop last week. And third, there's a proposed conceptual amendment. You should have these hard copies, and I think it's uploaded on Nellis as well. As a brief overview, the Nevada Silverhead Legislative Forum was created in 1997 to identify and act upon issues of importance to aging persons. It is comprised of up to 21 members who must be 60 years of age or older, nominated by state senators and appointed by the Legislative Commission. The forum may submit 1 bill draft request to each regular legislative session, which for this session is Senate Bill 60. At its work session last interim, the forum voted to request the drafting of SB 60 to be considered during this legislative session. Among other items, the bill, as introduced, expanded the list of crimes against older or vulnerable persons that require the imposition of additional penalties. These crimes included theft, fraud, forgery, larceny, deceptive trade practices, residential burglary, and home invasion. The Senate Committee on Judiciary voted to amend the bill by removing certain provisions that would have expanded the categories of crimes eligible for additional penalties. And Chair Dondero Loop, with your permission, I will briefly summarize the key sections of the bill and as well as the conceptual amendment. So Section 1 of this bill expands the list of crimes against an older or vulnerable person that require the imposition of an additional penalty to include certain forms of theft. And Section 6 adds those forms of theft to the list of crimes for which a person is also liable for a civil penalty, which may be recovered by the Attorney General. Regarding the conceptual amendment, Forum President Almaraz proposes to expand the list of crimes by including forms of deceptive trade practices punishable by a felony pursuant to Chapter 598 of Nevada Revised Statutes. Specifically, the additional penalties would apply if a natural person, firm, or any officer or managing agent of any corporation or association knowingly and willfully engages in a deceptive trade practice, knows or intends that the victim is a senior or vulnerable person, and the crime causes a loss of property or services that leads to a felony conviction. I briefly want to address the fiscal impact of this bill. Nevada's Department of Corrections submitted a fiscal note for this bill as introduced that estimated a fiscal impact over $2.3 million as an effect on future biennia. However, since its introduction, the bill has been significantly amended, and to my knowledge, the department has not submitted a revised fiscal note, so I'm unable to offer any details as to the fiscal impact of the bill as amended at this time. All other fiscal notes that were submitted either noted zero fiscal impact or that the exact fiscal impact could not be determined. And thank you for time. This concludes my presentation of Senate Bill 60.
Thank you very much. All right, questions on this bill? Senator Wynn.
I just want to clarify. I know the note from the fiscal note from NDOC, that's purely speculative as to who might commit this crime. Is that correct?
More speculation.
Or maybe that's a question for
Mr.
our
Thorley.
fiscal staff.
Wayne Thorley for the record, LCB Fiscal Analysis Division. After this bill was amended in the Policy Committee on April 18th, we received an email from the Department of Corrections indicating that they still anticipate a fiscal impact to be seen after a 4-year delay from the implementation of the date of the bill, and then again using estimates or average daily cost per offender of $91.43. That's where they're coming up with these numbers, and it's approximately it starts off a couple $100,000 per year and then increases to about $1 million per year. And again, that's based off of projections of the number of individuals that will be convicted of a crime under this bill.
All right. Thank you very much for that information. All right, not seeing any other, you may step back and we'll go to those in support of Senate Bill 60. And only if you fit in this category can you come forward. Just teasing you, Mr. McKay.
Okay, with that, good afternoon. Almost good
You
evening.
know, it's 5 o'clock. I mean,
I'm here for 3 people. My name is Rick McCann, MCCANN. Good afternoon, good evening, whatever it is, Madam Chair, members of the committee and staff. I'm here today representing locals, Teamsters Locals 14 and 986, and I'm old. Therefore, I strongly support SB 60. Thank you.
but yesterday we knew how to do pencil and paper. All righty. With that, Mr. Lopez.
Yes. Good afternoon, everyone. For the record, my name is Al Lopez. I support I'm actually here representing the sheet metal workers, area of transportation workers, but I'm also here to speak on behalf of Fran Alvarez. She asked that I speak in support for her, so she's definitely watching the bill, so we're here in full support.
Thank you so much. All right. Any additional support here in Carson City, in Las Vegas, and to the phone lines, AVH, when you're ready.
Chair, your public line is open and working, but you have no callers at this time.
Thank you very much. We'll go to opposition. And opposition in Las Vegas, and we'll go to the phone lines, AVH, when you're ready.
You have no callers in opposition at this time.
Thank you very much. We'll go to neutral. Neutral in Las Vegas, and the phone lines, AVH, when you're ready.
If you would like to provide neutral testimony on SB 60, please press *9 now to take your place in the queue. Again, if you recently just joined us and you would like to testify neutral, please press star 9 now to take your place in the queue.
All right. Support here in Carson City in Las Vegas. Enter the phone lines AVH.
Caller with the last 3 digits of 654, you are unmuted. Please continue.
Okay, hello. Sorry, I didn't realize that I was. This is Connie McMullen, and I am president of the Senior Coalition of Washoe County. And I have owned a senior newspaper for 33 years. And in the course of my owning that paper, I've been targeted because of the word senior at the beginning of my title. And I really think that these kind of crimes are proliferating, they're growing, and they're heinous. And in many respects, they target people over age 65. I can call in and testify because I'm age 70. And so I really do support this bill. I support it on behalf of my constituents and the members of the Senior Coalition and ask that you do too. Thank you.
Thank you very much, and thank you for that call of support. Is there anyone else in neutral on the phone lines? AVH, when you're ready.
If you recently just joined us, we are currently taking neutral testimony on Senate Bill 60. If you would like to testify neutral, please press star 9 now.
Apologies, Chair. I'm testifying in support. My name is Alex Noriega, representing the Nevada State AFL-CIO, and we are in strong support of SB 60. Thank you so much.
Thank you very much. Any additional callers in the potluck category?
Chair, you have no more callers wishing to testify at this time.
Okay, thank you very much. Any closing comments, Mr. Ashton? Okay, with that, I will close the hearing on Senate Bill 60, and we will go into recess just for a minute. We're going to regroup ourselves for work session.
I'm testifying.
All right, we're back in order. All right, we are going to do a work session, and we're going to start out with Senate Bill 475. Oh, I'm sorry, Senate Bill 172, and we'll start with Mr. Thorley.
Thank you, Madam Chair. Wayne Thorley for the record, LCB Fiscal Analysis Division. Senate Bill 172 was heard was that this morning? No, it was heard yesterday. I don't know what day it is. All right, Senate Bill 172 was heard yesterday in this committee, prescribed certain rights for agricultural workers. There was an amendment proposed at the hearing that would delete Section 21 in its entirety. There was testimony provided that the proposed amendment that I just mentioned would remove the fiscal impact. So if the committee wishes to move the bill, the appropriate action would be amend and do pass as amended.
Thank you very much. I'll accept a motion.
I'd so move to amend and do pass as
Thank you.
amended.
Thank you very much, Senator Wynn. Seconded by Senator Canizaro. Do you have a question, Senator Titus?
No question, just a comment that this will be devastating to the agricultural industry in the state of Nevada, and will do opposite of what the bill proponent wants to do, regardless of whatever the fiscal note is. I am a no.
All right, thank you very much. Any additional comments? All right, not seeing anybody. All those in favor say aye. Aye. All those opposed say nay. Okay, a nay from Senator Titus, Senator Stone, and Senator Buck. Motion passes, and we'll give the floor statement to Senator Flores. And with that, we will go to Senate Bill 182.
Thank you, Madam Chair. Wayne Thorley again for the record, LCB Fiscal. This bill was also, Senate Bill 182 was also heard yesterday in committee. Revises provisions relating to the staffing of healthcare facilities. No amendment discussed yesterday. There is a small fiscal note from the Office of the Labor Commissioner, which is general funded, but the committee does have the option to pass the bill without adding any additional general fund. And if needed, this is from the Labor Commissioner, could come to the Interim Finance Committee during the interim if needed. So if the committee wishes to move the bill as is, the appropriate action would be to do pass.
Thank you very much, Mr. Thorley. I'll take a motion.
So move to do pass.
Thank you very much, Senator Wynn. Second by Senator Canizaro. Any discussion? Senator Titus.
Thank you, Madam Chair. Yet again, another bill that well-intended, hoping to increase access to health care, and will do completely the opposite of what the bill is intended to do, and I will be a no. Thank you.
Thank you very much. All right, with that, all those in favor say aye. Aye. All those opposed say nay.
Nay.
Nay from Titus, Stone, and Buck. Thank you very much. Motion passes, and we'll give the floor statement to Senator Wynn. All right, we will go to Senate Bill 217.
Thank you, Madam Chair. Wayne Thorley again for the record, LCB Fiscal. Senate Bill 217 was heard yesterday in this committee. It makes revisions relating to reproductive health care. There was a conceptual amendment provided yesterday that would exempt association healthcare plans from the infertility coverage mandate. It would delay coverage mandate implementation date for Medicaid and PEB to FY28, but preserve the ability for Medicaid to seek a waiver for these services prior to the implementation date. And then lastly, would remove references to member of the insured group, so the coverage mandate applies only to groups with 50 or more employees to ensure consistency with other provisions of state law. If the committee, that conceptual amendment addresses the fiscal notes, so if the committee wishes to move this bill, the appropriate action would be amend and do pass as amended.
Thank you very much, and I'll accept a motion.
I'd so move to amend and do pass as amended.
Thank you very much, Senator Wynn. Second from Senator Canizaro. Any discussion on this bill? Senator Titus?
Thank you, Madam Chair. We're just madly looking this one up because I can't find it. Is it the one that? Thank you, Madam Chair. I was making sure it wasn't the one that I was going to support because I wanted to vote yes on the good one. This is going to be a no. Thank you very much.
Well, if you'd like, we can tell you which ones are good. I can tell you a few from earlier today that were good.
Thank you, Madam.
Well,
thank you, Madam Chair. I will be a no on this.
Thank
the
you very
policy.
much. With that, all those in favor say aye. Aye.
Aye.
All those opposed say nay. Senator Titus, Senator Stone, Senator Becker, no, and the motion passes, and I'll give the floor statement to the Majority Leader. All righty, Senate Bill 257. Thank you very much.
Thank you, Madam Chair. Wayne Thorley again for the record. LCB Fiscal Analysis Division, Senate Bill 257. Was this heard this morning? I don't know what's going on. All right, this was heard this morning. Revised provisions relating to autism. Let's see. There was no amendments discussed or presented this morning, and I think all the fiscal impacts have been addressed. So if the committee wishes to move this bill, the appropriate action would be do pass.
Thank you very much. I'll accept a motion.
I'd so move to do pass.
Thank you very much. Second from Senator Canizaro. Any discussion on this bill? Senator Titus, are you good? Oh, good. All righty. Then all those in favor say aye. Aye. All those opposed say nay. Motion carries. Thank you very much. And I will take the floor statement. All right, we will move on to Senate Bill 263.
Thank you, Madam Chair. Wayne Thorley again for the record, LCB Fiscal. Senate Bill 263 revises provisions relating to pornography involving minors. This was presented this morning by Senator Canizaro. There is an amendment that was presented and discussed this morning. I won't go through it in detail since it was just presented this morning. If there's any questions, though, happy to answer those questions. NDOC does have even with the with the conceptual amendment presented, Department of Corrections does have an estimated fiscal impact of $100,000 to a couple $100,000 per year, based on estimated number of offenders or individuals that might end up incarcerated based on this bill. If the committee wishes to move the bill without adding any additional funding, the more appropriate action would be to amend and do pass as amended with the conceptual amendment presented this morning.
Thank you very much, and I'll accept a motion.
I'd so move to amend and do pass as amended with the conceptual amendment that was added this morning.
Thank you very much. Good job. Second from Senator Stone. Any discussion on this particular bill? If not, all those in favor say aye. Aye. All those opposed say nay. Motion carries, and I will give the Majority Leader the floor statement. And we will go to Senate Bill 275 when you are ready.
Senate Bill 275 was also heard this morning, revises provisions relating to domestic relations and presented by the Majority Leader. There was a conceptual amendment presented this morning Again, I will not go over that in detail unless there's any questions. There was testimony provided by the Assistant Court Administrator, John McCormick, that with the conceptual amendment, the fiscal note from the court system is removed. Accordingly, no fiscal impact. If the committee wishes to move this bill, the appropriate action would be to amend and do pass as amended with the conceptual amendment from this morning.
And with that, I will accept a motion.
I'd so move to amend and do pass as amended with the conceptual amendment that was presented this morning.
Thank you very much. And with that, second? Second from Senator Stone. Any discussion? All those in favor say aye. Aye. All those opposed say nay. Motion carries, and I'll give Majority Leader the floor statement. And we will go to Senate Bill 312.
Wayne Thorley again for the record, LCB Fiscal, Senate Bill 312 was heard this morning, NAC's provisions relating to the health of American Indians. There were no amendments presented, but I think, did you want a statement, Senator Wynn, or?
All right, I'll accept a motion.
I would so move to amend, and my proposed conceptual amendment would to remove the general funding and direct DPBH to allocate some of the public health infrastructure money. I believe it was, what's the total amount?
$7.5 million a year, 15 over.
No, for this.
Oh, yeah.
$224,000 over the biennium. And for those of you that will remember, what we voted on and included in the budget was that public health infrastructure. It was included in the governor's recommended budget that we ultimately voted to approve. That included $15 million for public health, including small public health dollars. And so if we can just make sure that that is included, that money from this bill is coming out of that funds. So I know that is a very long motion, so I'm going to say that again. I would move to amend the language of this bill to remove the general fund funding and to direct DPBH to pass through the public health infrastructure dollars in the amount of $224,000 over the biennium.
Thank you very much. Second. Second from Senator Canizaro. Any discussion on this motion? All those in favor say aye. Aye. All those opposed say nay. Motion carries, and I'll give Senator Donate the floor statement. And we will go on to Senate Bill 329.
Thank you, Madam Chair. Wayne Thorley for the record, LCB Fiscal Analysis Division, Senate Bill 329 was heard yesterday in committee. Requires certain persons to complete training related to elderly persons and persons with cognitive impairment. Testimony provided that the amendment adopted in the policy committee removed the fiscal notes on the bill, so there's no longer a fiscal impact, and there were no amendments discussed. So if the committee wishes to move this bill, the appropriate action would be to do pass.
Thank you very much, and I'll accept a motion.
I'd so move to do pass.
Thank you very much. Second from Senator Canizaro. Any discussion? All those in favor say aye. Aye. All those opposed say nay. Nay from Senator Titus, Senator Stone, and Senator Buck. And with that, I'll give the floor statement to Senator Flores. Thank you very much, and we'll go on to Senate Bill 344.
All right, Senate Bill 344 was heard yesterday in committee. Requires certain health insurance to cover certain screenings for certain genetic disorders. There was a conceptual amendment discussed at the committee yesterday that I think is in my email. If there's any questions, let me know. There was a fiscal impact, estimated fiscal impact, with the conceptual amendment testified to by Medicaid of about $486,000 over the biennium. So if the committee wishes to include general fund appropriations to fund the estimated fiscal impact, again, that's about $486,000 over the biennium, the appropriate, and to adopt the conceptual amendment that was presented, the appropriate action would be amend and do pass as amended to include the conceptual amendment and the general fund.
Thank you very much. And with that, I'll accept a motion.
I'd so move to amend and do pass as amended with the conceptual amendment as presented today during the committee, as well as to include general fund.
Thank you very much. And with that, I'll accept a second. Second from Senator Canizaro. Any discussion on this bill? Senator Titus, please.
Thank you, Madam Chair. This was the good bill I was referring to. Thank you.
Music to my ears. Thank you very much. With that, we'll accept a motion. We already did. Oh, I'm sorry. All those in favor say aye. Aye. All those opposed say nay. And I'll give the majority leader the floor statement. Thank you very much. And we will go on to Senate Bill 422.
All right. Wayne Thorley for the record, LCB Fiscal Analysis Division. Senate Bill 422 was heard earlier this morning, and this committee revises provisions relating to voting. There is a small conceptual amendment that was discussed this morning. It would change the 4 instances of the word 13 to 18 in the bill. There is a small fiscal note from the DMV, $118,501 of highway fund impact in each fiscal year of the biennium related to the bill. However, if the committee wishes to move the bill, they could move the bill without adding that additional funding. And if the DMV needs additional funding in the interim, they could approach the IFC. So the appropriate action would be to amend and do pass as amended, including the conceptual amendment from this morning.
Thank you very much, and I'll accept a motion.
I'd so move to amend and do pass as amended with the conceptual amendment that was added this morning.
Thank you very much. Second from Senator Canizaro. Any discussion? All those in favor say aye. Aye. All those opposed say nay. Motion, we got Senator Titus, Senator Stone, Senator Buck, nays, and motion carries, and we'll give Senator Orenshaw the floor statement. Okay, we'll move on to Senate Bill 424. All righty, we will get started with Senate Bill 424. Mr. Thorley.
Thank you, Madam Chair. Wayne Thorley for the record, LCB Fiscal. Senate Bill 424 was heard earlier this morning, requires an assessment to be imposed on private emergency medical transport providers. There was an amendment submitted by Senator Oñate and presented this morning, a conceptual amendment. There was a second potential amendment discussed that we believe is no longer needed. And I'm going to turn it over to Mr. Kucera to give a little bit more detail on that.
Thank you, Madam Chair, members of the committee. John Kucera, LCB Fiscal, for the record. In conferring with our legal colleagues, it appears that Section 6, subsection 4, includes a variety of language, including that the assessment imposed pursuant to subsection 1 must comply with various CFR provisions, and it must not be imposed pursuant to subsection 1 if federal law or regulations prohibit using this revenue generated. So it would appear that the conceptual amendment proposed may be duplicative, and associated language noting that if the federal regulations or federal approval did not come through, that this would not be required. I'm happy to address any questions or concerns.
Thank you very much. Any questions? All right, I'll accept a motion.
I'd so move to amend and do pass.
Second by Senator Canizaro. Any discussion? All those in favor say aye.
Aye.
All those opposed say nay. Senator Titus, Senator Buck, Senator Stone, nays, and motion passes, and we will give the floor statement to Senator Donate. All right, we'll move on to Senate Bill 300.
Again, Wayne Thorley for the record, LCB Fiscal. Senate Bill 300 was heard on May 19th, makes revisions relating to Medicaid, and was presented by the chair. Hold on one second. So there was an amendment discussed to fund with, I think, provider tax revenue. So I will kick it over to Mr. Kucera again to discuss the amendment.
Thank you, Mr. Thorley. Madam Chair, members of the committee, John Kucera, LCB Fiscal, for the record. There was a proposed conceptual amendment that would fund Section 1 with general fund appropriations totaling $77,943 in fiscal year 25 and $104,981 in fiscal years 27, and would also authorize the expenditure of federal revenue totaling $179,425 in fiscal year 26 and $240,812 in fiscal year 27. Additionally, subject to federal approval, require coverage under Medicaid for Medicaid administration for persons, medication administration for persons with opioid use disorder, and to carry out this requirement, to require the transfer of $121,684 in fiscal year 26 and $382,542 in fiscal year 27 of the revenue from the assessments imposed pursuant to NRS Chapter 422-3794 from the account to improve health care quality and access created by NRS 422-37945 to the Nevada Medicaid budget account, and authorize federal funding of $545,735 in fiscal year 26 and approximately $1.7 million in fiscal year 27. So this would use general fund appropriations to fund Section 1 of the R1 version of the bill, and would utilize transfers of private hospital provider tax for the non-federal share for the conceptual amendment, which would include funding for medication administration for individuals with opioid use disorder. Again, happy to address any questions or concerns.
Thank you very much. Senator Titus.
Thank you, Madam Chair, for the question, because I do want to clarify that we are not using any opioid funds for resilient, the Fund for Resilient Nevada in this bill. Is that correct? So correct, we're not using any funds, right? What is, if we're using the provider tax, I want some reassurance, because I think we should be using the opioid funds, because I'm worried that the provider tax, we know there's a moratorium on any more of this provider tax stuff. I don't know that, do we have these funds available to now use for this program? Because I think it's a program we're supporting.
Chair, if I could respond to that, because I know I had been working on it for helping you with the amendment. I know in our my conversations with Administrator Weeks, as well as the proponents of the proposed amendments, for tracking purposes, they believe that using the provider funds for this purpose, there was plenty of them to be able to use for this purpose and tracking. And whereas some of the opioid funds were limited and might not be able to cover the complete cost of this.
Thank you, because, and again, thanks for the clarification, follow-up if I might, Chair, because one of the many committees we've been in and some of the testimony, we have been told that the federal government had delayed reimbursement and we had only gotten the first quarter of payment on that provider tax, and that they hadn't, provided us with the rest. Just wanted to make sure that we are good. Again, I support the program, wanted to make sure it's good.
It's my understanding in talking with Administrator Weeks that it was, and I believe Mr. Kucera might be able to expand on that as well during his conversations.
Thank you, Senator. Madam Chair, if I may, that's correct, Senator. When during the budget hearing for the Medicaid budget account 3243, the agency did indicate that the full federal approval for the calendar year 25 preprint was approved. However, you're also correct that there was an initial approval that allowed the first quarter payments to come out, but as of now, the calendar year 25 approval for the private hospital provider tax program has received federal approval.
Thank you very much. With that, I will accept a motion.
I'd so move to amend as presented in the conceptual amendment and do pass.
Thank you very much. And second from Senator Cannizzaro. Any discussion? All those in favor say aye. Aye. All those opposed say nay. Motion carries. Thank you very much. And I will take the floor statement. All right, we'll move on to Senate Bill 35, which we just heard.
Thank you, Madam Chair. Wayne Thorley, LCB Fiscal. Senate Bill 35 is just presented by the Attorney General's Office, revises provisions governing certain offenses relating to prisoners. There is a small fiscal note from the Department of Corrections based off of a projected increase in offenders. If the committee, there are no amendments discussed or presented. Accordingly, if the committee wishes to move this bill, they could adopt a motion of do pass.
Thank you very much. Any discussion? I'll take a motion.
I'd so move to do pass.
Thank you very much. Second from Senator Cannizzaro. Any discussion on this particular bill? Hearing none. All those in favor say aye. Aye. All those opposed say nay. Motion carries. And Senator Taylor, would you please take this floor statement? All right. With that, we'll go to Senate Bill 60.
Thank you, Madam Chair. Wayne Thorley for the record, LCB Fiscal. Senate Bill 60 revises provisions governing crimes committed against older or vulnerable persons. This is the bill submitted by the Silver-Haired Forum. There was a conceptual amendment that was discussed by Mr. Ashton from the Research Division. And if the committee wishes to move this bill, the motion would be to amend and do pass as amended with the conceptual amendment presented just a few minutes ago.
Thank you very much. Any questions? All right, I'll accept a motion.
I'd so move to amend and do pass as amended with the conceptual amendment that was presented minutes ago.
Thank you very much, Senator Wynn. Second from Senator Cannizzaro. Any discussion? Senator Titus.
Yeah, thank you, Madam Chair. I just wanted to go on record acknowledging that I'm very impressed that the last two bills we just are passing out of work session are getting tough on crime. So thank you very much for this committee.
Thank you very much. All those in favor say aye. Aye. All those opposed say nay. And I will give the floor statement to Senator Wynn. All right, we are going to stop. Oh, no, we're not going to stop. I'm lying to you. We are going to go to Senate Bill 475.
Thank you, Madam Chair. Wayne Thorley, LCB Fiscal. Senate Bill 475 was heard yesterday in this committee. It's a one-shot appropriation bill for the Division of State Parks for equipment, replacement vehicles, and other items. There was a small conceptual amendment presented yesterday to decrease the amount of the one-shot appropriation in fiscal year '26 and increase it in FY '27. Overall, however, the amendment would decrease the total amount of the appropriation in the bill. And so if the committee wishes to move the bill, the appropriate action would be to amend and do pass as amended.
All right, I will accept a motion.
I'd so move to amend and do pass as amended.
And I'll take a second. A second from Senator Canizaro. Any discussion on Senate Bill 475? All those in favor say aye. Aye. All those opposed say nay. Motion carries. And Senator Titus, would you like to have this floor statement?
Thank you, Madam Chair.
And we'll go on to Senate Bill 477.
Thank you, Madam Chair. Wayne Thorley again, LCB Fiscal. Senate Bill 477 makes an appropriation to the Department of Taxation for the continued development and implementation of the unified tax system known as Project Mint. This was presented yesterday. There was a conceptual amendment presented which reduces the amount in FY 26 because there's additional ARPA funding available to cover those costs. So it cuts about $2 million off the cost in FY '26. And the amendment would also authorize, like I said, the additional ARPA funding for the system. And if the committee wishes to move the bill, the appropriate action would be amend and do pass as amended.
Thank you very much, and I'll accept a motion.
I'd so move to amend and do pass.
Thank you
As
very
amended.
much. Senator Wynn, second from Senator Canizaro. Any discussion? All those in favor say aye. Aye. All those opposed say nay. Motion carries. Senator Stone, would you like the floor statement? All right, we will move on to 480, SB 480.
Thank you, Madam Chair. Wayne Thorley again for the record, LCB Fiscal. Senate Bill 480 was heard yesterday. It makes an appropriation to the Office of Finance in the Office of the Governor for replacement of uninterruptible power supply equipment and related expenses. There was an amendment discussed yesterday to make the general fund appropriation in this bill a loan to the Office of the Chief Information Officer, which is consistent with the actions of the legislature in previous sessions, since that's an enterprise fund and does not receive direct general fund appropriations. Accordingly, if the committee wishes to move this bill, the appropriate action would be to amend and do pass as amended to make the appropriation a general fund loan.
Thank you very much. I'll accept a motion.
I'd so move to amend and do pass as amended with the amendment to make this a general fund loan.
Thank you very much. Any discussion? All those in favor say aye. Aye. All those opposed say nay. Motion carries. Senator Buck, would you like the floor statement? All right, we will move on to Senate Bill 481.
Thank you, Madam Chair. Wayne Thorley for the record again. Senate Bill 481 was heard yesterday. Makes a supplemental appropriation to the Division of Public and Behavioral Health for an unanticipated shortfall in the current fiscal year. As presented yesterday, there was an amendment to increase the amount of the supplemental appropriation in the bill by approximately $37,000, bringing the total to about $1.6 million. If the committee wishes to move this bill, the appropriate action would be to amend and do pass as amended with the increase.
Thank you very much. I'll accept a motion.
I'd so move to amend and do pass as amended with the increase.
Thank you very much. Second from Senator Canizaro. Any discussion? All those in favor say aye. Aye. All those opposed say nay. Motion carries. Senator Titus, would you like the floor statement, please? All right, we'll move on to 487, Senate Bill 487.
Thank you, Madam Chair. Wayne Thorley for the record again, LCB Fiscal. Senate Bill 487 was heard yesterday, makes an appropriation to the Secretary of State's office for costs associated with the business licensing system. There was an amendment presented to increase the amount of the one-shot appropriation from about 4.2 million to about 9 million. It was testified yesterday that the 9 million was the original ask of the Secretary of State's office and was reduced in the governor's recommended budget, and that testimony was also supported by the director of the GFO. If the committee wishes to move this bill, the appropriate action would be to amend and do pass as amended with the increase in the dollar amount.
Thank you very much, and I'll accept a motion.
I'd so move to amend and do pass as amended with the increase.
Thank you very much. Second from Senator Canizaro. Any discussion? All those in favor say aye. Aye. All those opposed say nay. Motion carries. Thank you very much. And I will give the floor statement Senator Stone. Thank you. Thank you. All right, we'll go on to Senate Bill 496.
Thank you, Madam Chair. Wayne Thurley for the record. LCV Fiscal Analysis Division. Senate Bill 496 was also heard yesterday in this committee. It makes an appropriation to the Department of Motor Vehicles for information technology system projects. One second, Madam Chair. Okay. There was an amendment, conceptual amendment presented by the DMV during the bill hearing yesterday. The amendment would reduce the amount of these are highway fund appropriations in this bill, by a couple $100,000, and also add language to allow the appropriations to be transferred between fiscal years with IFC approval. And so if the committee wishes to move this bill, the appropriate action would be to amend and do pass as amended.
Thank you very much, and I'll accept a motion.
I'd so move to amend and do pass as amended.
Thank you very much. Second from Senator Canizaro. Any discussion? All those in favor say aye. Aye. All those opposed say nay. Motion carries. And Senator Neal, would you like this for a statement, please? All righty. I think now we are at a stopping point for the day. And with that, we will reconvene tomorrow. We will once again hear some bills, do some do some work session, floor session too, but work session. And we'll just keep plugging along. Thank you all for joining us tonight for finance, and committee members, thank you. And with that, this meeting is adjourned. Public comment? Any public comment here in Carson City? Las Vegas, phone lines, AVH, when you're ready.
If you would like to provide public comment, please press *9 now to take your place in the queue.
Kent Irvin, ERVIN for the Nevada Faculty Alliance. As the end of session approaches, you may wonder why NFA is not present in support of NC items that are certainly meritorious and very much needed. Given the very limited available funding, we must concentrate on the highest priorities of our constituents. We represent faculty statewide and do not prioritize projects that benefit one or two institutions when there is not enough money to go around. That said, NFA's final budget priorities are, first, improving campus security statewide after the tragic events at UNLV showed how ill-prepared we are. That's in AB 567. Second, filling the budget holes and refilling vacant positions created by the extraordinary and very much appreciated COLAs for NC classified and professional employees last session without further increasing student fees. Those are in SB 472 and AB 568. Third, given the increased employee retirement contributions and continuing inflation, COLAs are needed for all state employees, whether or not they are covered by collective bargaining agreements. Without enactment of AB 191, NC faculty and graduate assistants do not have the right to collective bargain in state law. Without COLAs, take-home pay of state employees will decrease. Finally, the one-shot appropriations in 2023 to expand nursing education are now being implemented, but adding nursing faculty to expand capacity is a continuing cost. Nevertheless, keeping the nursing pipeline open, at least through the one-shot appropriation in SB 498, is essential. The same concept applies to SB 472 and AB 568 for COLA funding, which was moved to one-shot appropriations with the governor's budget amendments. Thank you for your hard work, and thank you for your favorable consideration of these items.
Thank you very much. Any additional callers? AVH.
Chair, you have no more callers at this time.
Thank you very much. All right, and now I will adjourn the meeting. Thank you very much.